Welcome back to today's medical coverage with Dr. Laura Waters from Mercy Pediatrics. Good morning.
Good morning.
We are talking about the coronavirus today, which you have probably seen all over the news. We actually have new numbers out today about how the virus is affecting people. So the latest is that 425 people are dead, mostly in China, and that 20,000 people have now been infected. And you told me that you are a nerd for infectious disease. To put it
Yes.
some way, you know a lot about it,
Yes.
right? Okay, so what can you fill us in on?
So the coronavirus that's going around right now is a new strain.
Okay.
And that's the part that makes it a little bit more scary for people because we're not sure exactly how it's going to act. There are certain things that we do know about the virus. It is similar to flu symptoms.
Okay.
And so it's going to cause things like runny, stuffy nose, sore throat, fever, cough, and looks like a lot of other respiratory viruses that we see in the winter and spring.
And so this video that we're seeing is from China, where people are wearing the face masks, hoping that will help keep them protected,
Right.
and where they built a hospital from the ground up in 10 days. And things seem really scary in China, but are we overreacting here, do you think?
I think the response here is appropriate because I think we need to prepare ourselves, but I don't think we need to live in a state of fear currently.
Okay.
Obviously, I'm more concerned at this point about flu. We've got a lot of cases here in the U.S. and a lot of cases here in Missouri just in the last week. Cases have really picked up in our office, but I also think that we need to be aware of the situation going on and prepare ourselves, but I also don't think that people need to be super nervous. Coronavirus is actually a common virus here in the U.S. in the winter and spring and causes typical symptoms. So it can cause things like croup and bronchitis and other things. So we see coronavirus seasonally every year. It's just that this particular strain happens to be a lot more severe and is acting similar to Sars that occurred in 2002, 2003. And that was a pretty severe virus where the respiratory complications became much more severe.
And what happened with SARS?
So SARS, because of the public health outbreak in China and elsewhere in that region, a lot of public health officials really kind of clamped down, and they did a really good job of taming the virus. And after 2004, we have not seen any more cases of SARS. Unfortunately, because again, it was a new strain of the virus, you can get sick very quickly, and so but people did a very good job of really containing that and following the directions of public health officials in order to contain the virus.
Okay, Dr. Waters, let's go back to the flu just for 1 second here, because we do have new statistics about flu numbers out today as well. And so from October to the end of January, we know that up to 26 million people were infected and up to 25,000 people have died. So that's why you say in your office, that's the scarier thing for you right in this moment.
Right. So flu is definitely out there. You're more likely to get flu than you are coronavirus at this time. And I think, you know, if you haven't traveled to China, then your risk of coronavirus is pretty slim currently in the U.S. But there is a lot of flu going around. And so please make sure that you're washing your hands, that you are staying in your house and quarantining yourself if you have flu symptoms, and don't send your kids to school if they have symptoms, because there's a lot of children that are getting infected right now, and so we want to try and keep people from spreading the flu as best as we can.
All right, Dr. Waters, thanks for shedding some light on what seems like a mystery virus to us back here.